Senator Bob Corker is a Tennessee Republican who sits on the Banking and Aging Committees. Senator, mandatory question of the day. Congressman Joe Wilson, South Carolina, last night, you lie. What do you think?
Look, that was very not good. It was the wrong thing to do. The office of president should be respected against protocol. My understanding is he apologized formally afterwards and realized himself that he certainly stepped across the line.
Well, Senator, let's take the word lie out of the equation, but you've had some reservations and several comments about the senator's speech last night and about the health care proposals that the president is advocating. So do you think, is he fudging the facts? Is he tripping around the truth? What is he doing in your mind?
Yeah, look, first of all, I think there are things that we need to do to reform health care, and I think the White House knows that I believe that. I've said that in every town hall meeting I've had, and I hope that we can reach a middle ground and do some things that are pragmatic, that really move the ball down the field and don't do any harm. I thought last night's speech was a little bit more like, say, a primary speech in Iowa or something like that that was rhetorical. And for that reason, I today emailed over to the White House Chief of Staff, to Nancy Ann-DePaul, that's handling the health care issues, a request for some text so that we could actually put some meat on the bones and understand more specifically what the president was saying. I left there last night really with more questions than I did answers. And so anyway, I think for this debate to be advanced, we really need to understand what was said in its text form, what he means by these types of solutions, and I think that would advance the debate if they would actually come forth with that.
So you used the phrase, it sounded more like a primary speech in Iowa, and today the President of the United States had 18 or 19 Democratic senators down the White House to discuss this. Do you get the impression that they're just going to go right forward with a Democratic bill and then they're going to really leave you on the sidelines if that's what they have to do?
I felt like, look, in fairness, I know that I'm viewed as somebody who wants to solve this problem. I felt like last night the train left the station, that in essence it was about consolidating the base, if you will, behind the president, and I really did feel like that we reached a fork in the road last night with that speech. I don't think that is best for the American people. I think that that's going to be very problematic for all involved. I hope that that's not the case, but that was my sense as I listened to what was said last night.
So what's your biggest reservation or reservations about the proposal that's coming out of Max Baucus's committee?
Well, there are a number of things. Let's move policy aside. I really, as it relates to what happens at the end, I personally believe we do need to have things like exchanges. We need to deal with the issue of pre-existing conditions. We need to have cross-state line competition. I think all of those things need to be addressed. I think we need to have some tax code changes so that people can, in a more affordable way, purchase health insurance. What worries me is how this is being paid for, among other things, on the policy side. But for instance, taking $410 billion out of Medicare, and I'm not saying that that's cutting services, but what it is doing is making sure that Medicare is not solvent, that we're not dealing with the issue that Medicare is going to be insolvent in the year 2017, and we're not even dealing with the issue of making sure that next year we don't have a 23% cut with physicians and nurses. Secondly, pushing off the cost to states. I can't imagine us considering pushing off the cost of raising Medicaid levels off to states. That, to me, makes no sense. So there's numbers of things. What's happening here in Washington right now is that we are playing what the 10-year budget window game. In order to finance this, the Finance Committee is looking at 10 years' worth of revenues, but 7 years worth of cost. And what that means is we're going to have deficits into the future. So there are numbers of pieces to this that I don't think will pass the common sense test for the American people. I don't think Republicans, Democrats, or independents are going to like the outcome if we go through this reconciliation process, which I fear is the direction that we're headed.
Now, see, as I listen to you and your nice, soft Tennessee accent, I'm thinking to myself, now, here's a moderate, congenial guy. He's making sense here. So let me ask you, how many times have you been invited down the White House to talk to the president in these tones?
I went down and met with the president maybe a week and a half before recess, which I appreciated. And in that meeting, Mike, I said exactly what I just said to you, concerned about taking money from Medicare savings and not using it to extend the Medicare program, concerned about pushing Medicaid off to states, concerned about the budget window. And the fourth thing I would say is the fact is that there's a lot of tough sledding that needs to take place to really solve this problem, and it's going to take leadership at HHS and CMS. But I've been down there once. I've had conversations with Nancy Ann DeParle. I've talked to Rahm Emanuel over the weekend. I've talked to Max Baucus numerous times. I've probably been to 50 or 60 meetings. But my sense is that that we're stuck, that we're in this mire, that instead of reaching a middle ground, I feel like we're heading towards the path I just mentioned. And again, I don't even think that's going to be good for the Democratic Party should that occur. My concern certainly is not for the Democratic Party, but to make sure that we have a policy that will stand the test of time. And I'm just afraid that that's not where we're heading, especially as I listen to the speech last night.
Senator Bob Corker, thanks very much.